There he is. Thank you, Baz, for coming. Baz is the associate to the Ontario Minister of Health. So we've got some great support from there. I'd like to recognize one other individual who's here today, Dr. Sudi Devanestan. Sudi, where are you? Oh, okay, he's amongst us somewhere. So he's a pioneer in diabetes research and a recipient of the Order of Canada for his work. So we're very pleased that he's able to make it today as well. So let me tell you all about the dream of SAPNA and how we're going to bring SAPNA to life. So this is what I'm going to share with you over the next 15 minutes or so. So I'll describe for you what SAPNA is. I'll talk about why we so desperately need an organization like SAPNA. And like I said, I'll try and bring for you to life what SAPNA will be all about. And finally, we need your help. We need your help to understand the health issues that are affecting South Asians to improve the lives of our community. So what is SAPNA all about? Well, I think it sums it up quite well in terms of our vision. So our vision is to become the leading non-profit Canadian network dedicated to raising awareness of health-related issues within the South Asian community and promoting personal growth of its membership. Now, what makes us unique, we feel, is that we bring these two elements together. So what that means is that while our members give back and feel good about giving back, we also want to help them to grow personally and to grow professionally. Now, our focus is on improving awareness of health issues, of course, but as an organization, we must have a solid foundation. And I won't dwell on this today too much, but I do feel it's important to point out that we've spent a lot of time on this. For example, on our framework in terms of how we'll behave and in terms of a constitution to guide us. We're a not-for-profit group, we're a volunteer-based organization, and our aim is to be ethical, transparent, and with solid corporate governance. Okay, so why are we here today? Well, as good as this looks, you won't be getting any sweets here today. But for me, this picture illustrates a lot about what South Asians are all about. And it pictures, I think, one way in which we're unique in this world. But beyond sweets and food, we have an amazingly rich culture and an amazingly rich history. South Asians have an incredible work ethic. We have a great focus on education. All good things to be proud of. But there are some things about us which are not so good. And in the next few slides, I'm going to share some statistics with you which won't generate quite the same feelings of pride. And the important point here amongst all these statistics is that it's taking us in the wrong direction. Let's start with South Asians and diabetes. I've got this thing about sweets, right? Keep on showing you these sweets. So if it makes you feel hungry, we will be serving some healthy desserts and coffee around 8:45. So in the meantime, did you know that diabetes is 2 to 3 times more prevalent in Canadian South Asians than in the general Canadian population? What about cardiovascular disease? Now, we know that South Asians have made homes all over the world. They're in the UK, they're in the USA, they're in Australia, and of course, they're in Canada. But apparently, Canadian South Asians have the highest rates of heart disease amongst any South Asians that are settled anywhere in the Western world. And coronary artery disease strikes South Asians 4 times more than the general population. Even if you're a vegetarian, even if you're a non-smoker and you're not overweight, you're not immune. Of course, we hear so much about heart disease and about diabetes, but that's not all when it comes to important health issues for South Asians. So let's take a look at some others. There's a far greater stigma, pressure, isolation that's associated with mental illness. Families will hide their children away, thinking that it's going to somehow lower their family's shame about that feeling. There are higher hospitalization rates for asthma patients. There's a belief that asthma is a disease in the head, and that potentially life-saving medications should be avoided because they could be addictive. For a number of reasons, South Asians generally tend to have lower screening rates for various types of cancer. And let's not forget the barrier of language, which can seriously limit access to healthcare, especially for new immigrants and the elderly. So it's a serious issue. So what are we going to do? Well, there are many health professionals here who do a fantastic job taking care of patients within the healthcare system. And SAPNA is not trying to substitute for that. What we are aspiring to is to educate and empower the South Asian community so that their awareness of important health issues is increased, so that they better understand how to prevent or delay disease, so that they better understand how to get help, how to get treatment, so that they can take better control of their health.